Hi, so welcome to breathing. We're just going to review what pretty much you see all over YouTube and recommendations is the belly breathing or the abdominal breathing, because so many people will be shallow from the chest and you want to breathe deep in the abdomen. So we're just going to go through just a couple examples of that, because when you breathe with your abdomen, you're pushing down, the diaphragm is being contracted, it moves down, which then gives your lungs more space to expand. So I'm wearing this just so that you can see the difference. So here's chest breathing. It's very shallow breathing. You don't even feel like you're filling your lungs, especially once you get used to abdominal breathing. So here's abdominal breathing. You're going to breathe and you're going to move your abdomen down and you're going to feel the lungs fill up. And in fact, if you keep filling them, you can feel it when you fill out your lower lungs and it even going into your upper airways. So let's practice that. So you're going to, I can't talk while I'm doing it, but it's going to go down. You'll see my abdomen go out and then release slowly. So here we go. Now, when you first do that, it's going to seem odd and you might feel like I can't get my abdomen out. Well, keep practicing because you will be able to do it. And it's not only really good for your lungs, it's really good if you're anxious. It's good to help you sleep. So practice that because it's very good. You can even practice laying on your back on the floor, just even on your bed. Put on some nice listening music. I like to use hymns. I like musical things that have scripture to them that really reminds me of God's care, and it relaxes me and helps me to breathe. So that's the number one type of breathing that you want to do. But that didn't seem to actually help expand the lungs that had atelectasis, because what you need to understand is that in COVID pneumonia, the COVID spike proteins are so damaging. So I kind of explain it like this, is that when you get COVID pneumonia and you have those active viruses and they're just kind of going all around creating damage, it's like having a multiple vehicle pileup on an interstate. Everything's colliding, leaving stuff, and then what happens is once that's done, let's say the people are done crashing, well, and compare that to the viruses being done, they're not even alive anymore, and the EMTs come and clear up take all the people away for care or whatnot, and what's left on the highway is a disaster of parts and pieces and gunk and all that. That's basically what happens in COVID pneumonia. You're left behind with broken pieces of the spike proteins, all that create inflammation in the lungs. Now, I think it's important for you to understand just a basic understanding of the respiratory system and just how the lungs are. So it will help you understand your breathing exercises and what's going on. Of course, you have the main trachea that the air goes down, and then it divides into the two main bronchi. One to the right lung, which has actually 3 lobes in it, and 2 to the left lung that has 2 lobes in it. And just an easy explanation, you have a top, you have the superior and the inferior or the lower bases lobe, and in the right you have the superior, the middle, and the lower bases inferior lobe. And so you have the trachea that then goes into 2 main bronchus in these, and then the trachea that then goes into the 3 main bronchus into your 3 main lobes. Now the right lung is heavier than the left lung because of the anatomy, because you have the heart that is tipped towards the left, and so the lungs, having just the 2 lobes, make accommodation for that heart, and there's actually like a little notch or indentation where the heart sits between those 2 lobes. And so in fact, if anything's inhaled, sometimes when you inhale something, typically it goes down in the right because it has a straighter pathway to the right side. But anyway, so this is how your air gets in. So it goes from the larger to then it divides into 2 here, 3 here, and then it kind of goes out to be like a tree. So it's actually called bronchial tree. Bronchopulmonary tree. So, and at the end of the bronchioles, it's the tiniest of airways, just like a branch, but on the end are little alveoli, or called air sacs. If you can think of them as balloons that inflate and deflate. They inflate and deflate. When we breathe in, they inflate with the oxygen. When we breathe out, they shrink. Well, what we're trying to do in these exercises is inflate and get air through those tiny airways that in COVID pneumonia are swollen and closed off, creating the atelectasis, which means that these little air sacs or alveoli that are supposed to be inflating and deflating are just flattened because the tiny little bronchioles are inflamed from the tissue damage of the spike proteins and the virus, or they have mucus in. It's a combination of those things. So we want to work on clearing those out. Now, it's not going to come just with breathing exercises, but also with the other things that I have am teaching you in these videos: the percussion, the postures, postural drainage, and the nutrition and fluid and some of the supplements, the anti-inflammatory things that you're going to be consuming to help decrease the inflammation in your body. But I think it's very important that you understand that. Now I am going to get something else that I think will help you understand what these breathing exercises do. I don't want to make the video long, but I think it's imperative that you understand that in order to benefit from these. So I'll be back in a minute. Okay, now I have here, for example, these nylons. Now, so these are going to be like the little tiny airways. Now, there's many more than these, but these 2 will suffice. So when you have atelectasis, these things are just kind of, there's no air going through them. They're inflamed, they're stopped up, whatever the reason is. They're just not working. And all the little air sacs at the end, they're not getting anything. They're just flattened. That's why your oxygen is low, because you're not getting enough air that transmits from the air sac to the little capillary bed that comes next to it, where the air and the oxygen and the carbon dioxide exchange, the carbon dioxide coming from the bloodstream through the capillary, exchanging with the oxygen that's inside these little alveoli. That's where that exchange takes place, and that's why it's so important to get these open and working again, and these exercises, I believe, will help. So, especially with the bubbling. So, on the one, this works the inspirometer. So, this is going to work a certain way. This is what's typically used in the hospital when you get out and you basically have it set to whatever is expected and normal, and then you need to inspire, and they have different amounts of inhaled by milliliters. So for me, for example, for my age, I'm going to be 65, I'm 64, and of course being female, then it's going to be 2,025 is what it was. When I first started breathing on this, when I was sick, I could not get past 1,500. I tried. I just couldn't when I started. So don't be discouraged if you can't. But it came in bits and pieces. As I started using these combined methods, so the inspirometer that is commonly used in hospitals and for preventing pneumonia in hospitals, especially after surgery, and it's where you breathe out everything, and you breathe in, attempting to get as high as you can. There's also a little, looks like an upside down thimble, but it rises, and there is a best, better, and good category where you want to try to maintain that. It kind of floats upward when you suck in. And if you can keep it at the best level, so it kind of goes with the speed that you breathe in, you're going to get your best result. But no matter what, you should try to stay within the best and the better. But if you can, just start where you are. So you do that, and I always did 12 because I think of 12 as foundational. And sometimes I would do 15. I'd feel like the first 10 I would really get, and then I would try to always do about 5 more, trying to even get a little bit more done. So this is really important. I will put in the description below some videos that I found were helpful in using this, but it's pretty self-explanatory, and it does come with information on finding out what level you should be at. Now, what the difference is that I added is this, which is blowing through a straw into water, and I'll explain why. This is what I've used for years. I've had vocal cord problems for 30 years, but I've been with the same vocal specialist for 20 years who's done surgery. I've had so many scopes. I've had hemorrhages. I've had reflux. I have a left sluggish cord even now, and like I said before, I was in vocal therapy again when I got COVID pneumonia, and I was doing this very exercise. And it's meant to relax your vocal cords. Within the vocal cords, I think there's about 15 muscles in itself, and there's about 50 muscles in the neck. So all these are affected, and I really wasn't aware of all the vocal cord issues people have talked about that we're having from COVID, as well as the lung issues. So actually, this helped my vocal cords as well, because I can still sing. You know, I have parameters that I have to work in because of my left sluggish cord and some of my problems. But when I follow those, I can still talk, I can sing. So I understand what I'm doing. So why this works, I'm going to explain it, is this is just a glass of water, distilled. I put drinking water in it just in case I forget and I take a sip or whatever. And this is a straw. The water is about 3/4 of the way. This is a metal straw. I use metal because in a straight straw for the resistance factor. Why I'm talking about that is because when you blow in this, you create a back pressure into your lungs. It's kind of like a mini PEEP. What a PEEP is, it means positive end expiratory pressure. When I used to work with patients with ventilators, you had to monitor certain ones, and that was one because if you had too much PEEP, you could blow their lung out, and you didn't want to do that. So the PEEP helps to keep these airways open so that they can get oxygenated. So I think of it when you're doing this. Now, when I started this, I could only do 15 to 20 seconds when I had the pneumonia. Now I can get up to 60 seconds on a regular basis, and then sometimes up to 65, 70, 75, and one time I got up to 80 seconds. And I have so trained, you can hear just a bubble at a time, pop, pop, pop. I'll do that later in the video for you. But I just want to explain, you can start with however much you can do. If you can get 15 seconds or 20 seconds starting, that's great. But whatever you can do, that's what you do. Don't just burst forth, but if you can maintain that pressure, you're going to feel a back pressure into your lungs. That's what you want. It's creating that PEEP down in your lungs. And again, I'll put in the description some information and links where you can find out more about this bubbling exercise. But now I want to show you what the PEEP does. So say you got these little airways that are not even functioning, and they're just, you know, they're not doing what they're supposed to. They're not inflating. When you have PEEP, so I don't know, a lot of you ladies probably remember that when we used to put on nylons, we would have to put our arms through to open them up because they were all closed. So you would do this and you would open it all the way up to get it open, right? So then you have this open, right? So now look, it's not flat anymore, it's open. So also think of when they put stents in hearts, in vessels. Those stents are to hold open those heart vessels, those vessels, to keep them from flattening and collapsing. They're stenting it open. They're holding it open. When you create this back pressure, what it starts to do, and also when you're eating the diet and doing the nutrition and having the lemon ginger anti-inflammatory brew that I make to decrease inflammation, is that inflammation leaves down and you're creating that breath, that PEEP, it starts to push through it starts to reopen those little airways, starts to push through, you cough up the junk, your inflammation is going down, and it starts to open these up. Now, it takes time, so don't be discouraged, but that's how it was for me. So I got diagnosed with pneumonia in my mid to my lower lungs, so significant, on December 1st. By putting all the things that I'm sharing with you, by December 29th, my follow-up x-ray was that it was significantly improved, but that I still had atelectasis and or scarring in both bases. So I'm like, I know I need to get these open. So I committed myself to 2 to 3 months, 3 months of just, I was tired. I would get tired out from doing all this stuff. You know, you're exhausted when you have the pneumonia, but I knew I had to do it to get better. So I did these. I didn't do them every hour like the hospitals say to do this one every hour. It's pretty exhausting and wearing out. So I chose to do it every 2 hours because I was combining it with the other, and because I didn't feel like I was valuing, because I was so worn out, I wasn't able to even inhale it and even get it up more. So it seemed like 2 hours, so I did it 4 times a day. And so that's what I did, and I documented it in my little journals. I have documentations. This is my second one of all the time from, I think I started documenting from just before I have it written down when I saw the doctor, when I talked, and definitely from the time I went to the ER on November 27th and had my horrid experience. I definitely started documenting because I knew if I didn't get help, I was going to die. I told my husband that, and I had to get the right kind of help, had to do the right things. So that's what I'm teaching you, is what to do and the things that helped me. So now what I'm going to do is, and then once these airways are open, then the little balloons can start opening and getting their airways. So then when I had an x-ray on the end of March, the doctor said my lungs were sounding great and my lungs were completely clear, and I just went for my pre-op for my total hip, and they did an oximeter right when I walked in, and it was 100%. And once my inspired volume seemed to hit 1900 because it had been at 1500. My cardiac pain at night stopped. I didn't have any more chest pain. I was able to sleep, and my lungs were opening enough that I was getting enough oxygen that during the night, even if I was breathing a little bit more shallower, it wasn't creating the cardiac chest pain that alerted me that, hey, you're not being oxygenated, because I would get up, check my oximeter, and sure enough, it would be low, and I would have to get my husband up, wake up, and then I would walk, deep breathe, do my exercises, do percussion, do all that to basically save my life and to clean my lungs. So I'm speaking from experience. I know how frustrating, I know how frightening it is to not be able to breathe and to wake up with that. And like I said, I'm not afraid of death. I'm a woman of faith. I know I'm going to heaven. I know Jesus is there waiting for me. But that sense of, I always call it, I think it's God telling people, hey, if you don't have things right with me, better get them right, because guess what? This impending sense of doom is letting you know that something's not right, and either you need help. It's like seeing the red lights in a pilot's, when you're on a plane and you are flying a plane and you see these lights. It's like you better pay attention or you're going to crash, and that's what I think cardiac pain is like. So I knew that if I could get my oxygen up and the cardiac pain stopped, but I don't recommend that to anybody. Like I said, if you are low, you need to call 911. You can get evaluated. You may need oxygen. I'm a skilled nurse. I have expertise that you don't have. Of 40 years, I know when I would have needed to go in, and my husband would have called. So please don't. If your heart starts hurting and you get up and it doesn't go up, please call 911. Like I said, disclaimer, I'm not a physician, and I don't want you getting into a position where you're not able to get your oxygen up. So these are exercises to help you reclaim your lungs and rehab your lungs. But please, like I said, I have expertise that you don't have. I know what I feel like. My husband would have called. I would have called. Yes, it was scary, but I knew I was on medications and doing the things that needed to get done. And I know that I was doing what's right. I wasn't sure what would happen in the hospital and if it would be beneficial or not. If you get what I mean. And so I took care of it this way, and that's what I did. So anyway, we all have to make our own choices, and then we have to live with the consequences. So now I'm going to give you some close-ups of bubbling, because I think it's important. I really want you to hear what it sounds like when you bubble once you start getting it to where it's really under control. And then just keep doing it. Like I said, keep doing it until your lungs open, and then do these other things that I'm be recommending to you in the other videos. Okay, now I'm going to demonstrate the bubble blowing in the water a bit closer. One thing too that I want you to do is, and I'll again put a description, there is breathing exercises called Appoggio that classical singers use to get those long drawn out notes that take a lot of control. And so the stance that I like is the Appoggio stance. So pretend that you have a little thread going up through you first to get a good posture, and then you simply tilt your chest up like a little bird chest. That helps open up your airway, and then you would broaden this area, and you're going to broaden this area this way. So you're going to make it out so your lungs have an area to expand. So you see, this is my abdomen going out, my diaphragm's going down, my air space is enlarging for my lungs. That's the side. Now you also can expand it this way. See, it takes practice. But the main thing is having the chest and tipping it up. If you don't know what to do, put your arms up like this and then put them down, and your chest will be in the exact right state. It'll be in the right thing, and you can feel it. And it's just natural, but it's just kind of tipped up like a little bird chest. But you don't want it puffed out or up hard, because then that's just stressing you out. And that's not going to help at all. It's to make a area that's not constricting the lungs. That's the goal of the Appoggio stance. It's to make as wide an area so the lungs can really expand. Then what I do, I take, once I'm in my Appoggio, now you can do this standing or sitting. I have found if I sit on the edge of my couch, it feels like I have a good, like I have solid underneath me. It feels like I'm more supported than when I'm standing, for whatever reason it is. I started by standing, but it seems like when I sit on the end, sit up straight with my legs out on the floor flat in front of me, my chest is in the Appoggio stance. It's tipped. And like I said, don't worry about if you can't get your lungs out to the side or out this way. It's okay, but do have the chest up and then do the belly breathing. And when you wear something, make sure you're wearing clothing that will expand. And if you have buckled pants, please unbuckle them, unzip them, whatever you have to do to be able to expand your air, your lungs, and get that abdomen breathing out. And I even have like workout pants on, but those are typically a little bit too tight for me, you know, when you try to breathe it, but I used them just for the sake of you being able to see the abdominal breathing and stuff. Okay, so then we have a straight straw rather than a curved straw. Do the straight metal straw. The curve, it's all in the dynamics, right? The curve will take out some of that air that I want to come, the partial end expiratory pressure, I want it to come up straight through the tube into my trachea and down into my little bronchioles when I do this. So here we go. I'm going to get a little closer so you can hear it, and we'll see. Okay, I'm going to try to demonstrate a couple things. So when you breathe out, so here may be your first time when you do it. So you're going to do that. If you can do that 15 seconds, that's awesome. Some people run out at 5. Start where you're at and just keep it consistent and keep trying, right? You'll see it improve with time if you continue with this, as well as, like I said, the other things I give you. Because no matter, if you keep eating inflammatory foods and you're not taking enough fluids and you're not, you know, doing some of these other things, it's just not going to work as well. It has to be the total combination of these things in order to benefit you. Okay? All right. Now, I'm going to do it in a slow way. So this is what your goal is. Your goal is to go from this fast, speedy way to make it as controlled as possible. You will feel the back pressure into your lungs. It's like you just want to breathe out and put everything. Don't. Do it with control. Now, I don't want you to hold it so much that you pass out. Okay, let's use some common sense here. If you can't do it, don't like go for gold and then you end up passing out at the end. No, please be practical. We're not in a race with anybody here. We're getting ourselves better. We're reclaiming our lungs. Okay, so I can't see the clock I normally look at. It's over here in the kitchen. I usually look at that one to see what I am, but I just want you to hear some. I don't know that I'm going to go 60 seconds because of having to pay attention to all this other stuff. But I just want you at least to hear what it sounds like when you do it under more control. Okay, here we go. So you can see like that. And that, you'll feel that because you'll just want to let it all out. But if you can each time get a little bit better, and I would say to document, because it's so important for you to see that you are getting better and that you can see little by little your increments will grow. I mean, like I said, I was so discouraged and so concerned when I could not get above 1,500, and I was supposed to be getting 1,500 milliliters is quite different from 2,025 milliliters. That's like 500 milliliters of air. Think about that just in liquid, but this is in air, right? And so that's pretty significant, and that means there are portions of your lungs that aren't inflating and they're not taking in air, and thus you're not getting the oxygen you need. It's not even getting into those little alveoli to be then exchanged with the carbon dioxide that's in your tissues from the little capillaries. So, and then your cardiac muscle feels that. When that goes down, your cardiac muscle is hello, something's wrong, chest pain, feelings of impending doom, you better do something or you're going to crash. And so those are the things to watch out for. But if you keep doing this, I really truly believe that it is that combination of, and it seems like I always do this one first, the inspiratory. I'll do 15 on here. I'll do 10, and I document them, and then I do 5 extra because that's where I really push to see if I can get any higher. And then on the bubbling one, I do 5. I do 5 of these, and I do this 4 times a day. You could probably do 5 times if you want. I just, every hour, and maybe you can do it every hour, but for me, I was so sick and so worn out, I could not do it every hour. I was exhausted between that, doing my percussion, my postural drainage, making and drinking my lemon brew, ginger brew, and taking my ginger tea and some of the supplements and all this stuff, that it was just exhausting. So I get it. And I just want to encourage you too. So I want to encourage you that this really worked for me. And as a nurse, I can understand. And having worked on a chronic respiratory floor for a long time when I first became a nurse as an LPN, it really makes sense. And just knowing how it works, and having worked ventilators and knowing about positive end expiratory pressure and what that does to lungs. And I think having had my vocal cord injuries is kind of a disguised blessing for you all, because, and myself, I don't know that I would have even thought to add that. And actually, like I said, the great physician is the one that took care of me after that ER doctor just ran me for being unvaccinated. And that's a different story. I'll tell you how I got it, because I know for 3 weeks I was so busy trying to do videos and stuff that I was going to do for Christmas that I wasn't eating right. And because I wasn't eating, I wasn't taking my vitamins. I was having coffee, pop, and I was really stressed out over a few people that were having hard times. And well, that raises your cortisol, which decreases your immune system. So I was ripe for the picking for COVID-19. And if you if you watch my video on the basics, you'll find out about that, because my immune system was like, and I was tired, and that's what happened. But you know what I think? I had prayed, and I said, God, if you want me to say anything, you're going to need to make it personal. And so he made it very personal. I don't believe in coincidence. I don't believe in luck. I believe in God-ordained events. And I believe that we can use everything bad that happens to us, and when God helps us through it, that we can use that to help others. And he definitely gave me insight and rescued me and brought me back to health and helped me to understand what would work and what wouldn't work. So All right, that does it for this video, and I want to thank you again for joining me. It was a little longer, but it's very, very important that you know how to do these exercises and that you do them consistently and don't give up and do your best. But again, don't do it to where you're going to pass out. Let's use common sense, people. You'll get there. We're not in a race with anybody. We want to reclaim and rehab our lungs and reclaim those lungs and reclaim our life from the destruction that COVID left, because it can be done. All right, until my next video, bye and see you again. And remember, if you're interested in staying for prayer, I'll see you on the other side. Bye. All right, hi everybody that stayed for prayer. I'm glad you stayed for prayer, because guess what? I know that it really works. Sometimes you don't always get the answers, but I'll tell you one thing. God's heart is always a heart of love towards us. God is love. Have you ever thought about that? And He can do nothing but love us. Here's the difference we sometimes forget. God sometimes can be displeased with us when we're doing wicked things, but His love is always towards us. And in Ezekiel 33:11, it says this, "As I live, says the Lord God, I take no pleasure in the death of the wicked, but would rather that they repent and turn from their wicked ways and live." So God's heart is always a heart of reconciliation, a heart for healing. Of course, He does use things in our lives, and we're not completely healed till heaven. But there are opportunities for Him to heal miraculously, or like we said before, practically, where He wants us to do the practical things to take care of ourselves and take care of us, so that we can live for Him and we can do His work in this life. So I'm going to pray, and like I said, Jesus always prayed. Excuse me, I shouldn't say that. He might have prayed with His eyes closed at times. It's very possible, but I think He lifts His eyes to heaven and prays. And when He prayed, I keep thinking about the blind man that He put the mud in the spit and put it on his eyes. Had to be looking when He was putting it on his eyes and praying, right? So I'm praying with my eyes open, and I usually pray I pray a lot with my eyes open as I walk around the house, as I drive, whatever. Prayer is just talking to God, and He doesn't need fancy language. He just needs a heart that's sincere. Don't be a God user, because He can tell whether you're using Him or not. Let's be sincere. So let's go to the Lord in prayer. Father, I am praying for these people on the other side of the lens. I am praying for those who are viewing and watching right now. I know, God, from having been through this, that it is a struggle, and it's so discouraging when you can't breathe and you can't get your volumes up, and it's limiting you, especially if you've been an active person. It is really tough, and it's scary if you wake up at night and you feel that cardiac pain and you feel that sense of impending doom and you see your numbers drop. That's very frightening. But God, those of us that know You, we know that You're going to take us to heaven. When I got so exhausted, I said, God, I'm in Your hands. If You want me home, take me. But I'm exhausted. I cannot keep deep breathing all night long just to keep my numbers up. I have to go to sleep. And if I get cardiac pain, I'll wake up and start breathing. But my life is in Your hands. Ultimately, all our lives are in Your hands. For those, Father, that don't know You on the other side of the lens, and they're like, what is this lady even saying? She believes in God. She's praying to this God. Would You let them know that You love them? Would You let them know that You are real and You care for them, each and every one, that we are not millions of unwanted people, but that You want us. You want to be our Heavenly Father. No matter what our own father was like or our own family was like, You are the perfect Heavenly Father, and I have found that out in all my years of living since I committed my life to You at 17, and now I'm almost 65. You have taught me so much, and You have loved me. Would You love these people? Would You touch them and encourage them? Would You help them to do these exercises and help them to do the things that You taught me and You helped me to apply so that my lungs got completely better and that I don't have COVID brain. I have energy, and the only thing that slows me down is my painful left hip. And that was from my own problem from doing too many weights on the leg press in February of 2020. Things that a 60-something-year-old should not be doing, even if she feels like she's in her 30s. And yet you're being gracious, and you've helped me to tolerate the pain, and you've helped me to be able, and now you have this left hip coming up for me. And so each and every one of these dear ones are facing their own personal trials and challenges that I don't know, but you know. I pray that you would be with them, and in some way you would show them that you're there. Father, would you use me? Would you use me in these videos to help these dear ones that have suffered because of this virus, because of what happened because of it? Would you help me to be able to give the information clearly to them? And would you please help them to be able to apply it? Be with them at this difficult time. And Father, I pray all this in the mighty and the powerful name of my beloved Savior, Jesus Christ, King of Kings and Lord of Lords. And I thank you in advance for what you will do for these dear ones. Okay, well, thank you for prayer. Thank you for staying for prayer. You can always rewind it and listen to the prayer again if you want. God knows it from when it's from our hearts. And like I said, if you don't know to pray, just talk to him. Just talk to him. He would rather have a sincere heart with common language than poetic, whatever words, whatever, the best words, prayer, whatever, and a heart that's not there. He wants to know your heart. He wants to walk with you. He wants to be there for you. All right, until next time, I want to thank you again for joining me on the Reclaiming series. This is Betsy Bohan, and until the next time, bye.